I now will request Dr. Arun Chokalingam to give his closing remarks on the technical committee meetings. Professor Arun Chokalingam.
Good afternoon, everybody. It has been 2 days of tremendous knowledge sharing. Thank you very much for all of you who have shared your passion and communicated your phenomenal wisdom. And we have come to the very last part of the session to give the summary report from the 3 technical committees. And before I ask my colleagues to speak, I just want to say my heartfelt thanks to the 2 leaders for the biotech and artificial intelligence. And without your help, Rohin and Alex, I could not have accomplished, or we could not have accomplished. When Dr. Lakshmanan and Satish asked me to chair this committee, so we thought about the 3 areas, and then we said, I don't have the expertise or depth in these areas, then I've got to find people. And the Lord has mercy on us, and He has shown the way for us to identify people like Rohin and Alex, who spontaneously agreed. And you have been put through by me a lot of inconvenience for your family, and you always smile and you take it with the right spirit. And week after week, the committees have worked. And again, we are blessed with a number of committee members for each one of them. And they have offered their enormous scientific input to shape what we call as a white paper. And by the way, the white paper is still not finished. We still have some work to do. And you all have done a tremendous job. And in the process, you mentored a number of young people too. And this is great. And it is a tremendous investment for me to have your friendship. So with that, let me ask Dr. Alex Mihalidis, who is the Associate Vice President, International Affairs at UFT, and the Scientific Director of Agewell Institute, to present the summary from the Artificial Intelligence Group. Alex, over to you.
Great, thank you very much. And first and foremost, thank you to Arun and the team for giving me the privilege to be part of this and to help lead this one part of the conference itself. Also, as a scientist and a research chair at Toronto Rehab at CIHS, I was very, very happy to hear the announcement of the fund that's being set up with Dr. Paul O. And so, I think the work that we started to see today will continue significantly moving forward. To summarize what we've seen in the past 2 days, it's been a phenomenal discussion between our researchers and our counterparts here in Canada and in India around how artificial intelligence has been playing a role in healthcare, and specifically the role that's been played in COVID-19, the current pandemic. Some of the key summaries that we saw is that foremost, we really saw some significant advances made due to rapid partnerships during COVID-19. And some of these partnerships came together naturally, and some were people who've never worked and partnered with each other before. And more often than not, it was researchers in areas such as artificial intelligence partnering with clinicians and people on the front line. And this was really, really key in order to mobilize very quickly the solutions that were being developed. The one thing that also was discussed, I think, in everyone's presentation was the notion of data. We're reminded that good data is important for artificial intelligence. It's the old adage of garbage in, garbage out, and that's something we want to avoid, especially when we're applying AI in such critical areas such as healthcare and COVID. And so we are reminded that we need to continue to work together around good data sources. And a very strong thought that came out of our sessions that Canada and India are poised to be able to work together to maybe take on this challenge and to look at data. The interesting thing that we also heard, we had several presentations, not just from people doing work on AI, but also those in the marketplace, from the business community, venture capitalists, et cetera, that essentially are looking at, real world applications exist. And there's a great interest from that community to start to invest and to help bring these new technologies forward. The other thing I think this showed us is that very quickly, the AI community was able to pivot, and it was able to take on this new challenge. It was able to repurpose algorithms that we have used in other applications and domain areas, and really to drive forward to support the effort against COVID-19 and the pandemic. The final thing I'll say is, what do we need to get there? And, I think these 3 points I was presenting in our session yesterday are very good in terms of where we need to go. So first, we need to deal with the legal, the ethical issues around AI and health. We're collecting multiple different data sets. Some of it may be de-identified, but some of it may not be as we move forward towards personalized health. So we need to sort that out. So it's not just about the technical aspect, it's the social, ethical, cultural implications. I mentioned data access. And again, this is something where Canada and India can come together and lead the world in terms of data access of really unique and interesting data sets, especially, for example, from the rehab world. And finally, is we really need to come out of our silos. The computer scientists and the folks developing AI and robotics and other types of technologies cannot just be doing these things on their own. We need to be working together with the clinicians, the nurses, the doctors, the caregivers, the frontline workers to make sure that we are developing solutions that are important and effective. And again, going back to the notion of data to make sure that the data is being interpreted correctly, because it's really the domain expertise that drives not only the research questions, but the quality of the AI and the solutions that we're developing. So I'll stop there. Thank you very much, Arun.
Thank you very much, Alex. You really spelled out the real importance of artificial intelligence and to provide the accurate information. In this day and age, information is freely available. We get plenty of information in WhatsApp and in the social media, and half of them are not true. And working with the clinicians, working with the issues, working with the data, and to providing it, I think that is extremely important from a scientific point of view. Thank you very much for your leadership, Alex. Now, let me ask my colleague and friend, Dr. Rohin Iyer. I've never met Rohin. I still haven't met Rohin in person. My friend. But he has become such a good friend. I can call him upon at any time, and he's there to come to a rescue. And Rohin is an accomplished scientist, and he works in the cutting edge in genetics. And he works for CIPIA Corporation, and quite an illustrious person. And he's so well organized. Every time I go for the meeting, he has got everything laid out. And if you think that I'm a hard taskmaster, he's even more a hard taskmaster. And he got everybody to work and get the best out of everyone. Thank you very much, Rohin. Now let me ask you to provide the summary notes.
Thank you so much, Dr. Chockalingam. I mean, to be considered a colleague by someone of your stature and your repute is absolutely a privilege to me. I see you more as a mentor, and if anyone says that I'm a hard taskmaster, Dr. Chokalingam definitely takes the cake on that one. He's very influential, and he has an attractive personality that just brings in the best of the best. So thank you, Dr. Chokalingam, for your leadership. I would like to take this opportunity to thank the Biotechnology Working Group, Dr. Grant Pierce, Ms. Nikita Thakkar, Vali Natarajan, and also Dr. Chokalingam himself, who contributed significantly to our biweekly meetings. Those meetings ran late. Everybody contributed to them and attended them wholeheartedly. I'm not going to focus so much on the white paper topics that we covered yesterday, which included nutrition and its impact on COVID-19, cell and gene therapy, which is my area of expertise, or the impact of the vaccines themselves, because that was covered in detail yesterday. I'd just like to cover the biotechnology breakout session today and some key highlights here. Just because there was so much information, I could barely fit it on the slide. As you can see, this is a bit text heavy. But just to summarize some key highlights here. We heard from Dr. Fuller, Dr. Deborah Fuller, who gave us a sneak peek at some of her new second generation technologies at addressing COVID-19, which are the self-amplifying RNA vaccines that are being developed out of the University of Washington. And just the amazing things that they're doing with improving cost and scalability of production of those vaccines to address the pandemic. Dr. Andre Boulay took us through some of the botanical candidates that he's working with, known as thiamine, which have immunomodulatory effects. This is something that I'm familiar with the use of MSCs, mesenchymal stem cells, in the same manner, except that he was covering the glutathione and reactive oxygen species and how we can modulate the various pathways that contribute to the pathogenesis of COVID-19. Dr. Agarwal gave us a fascinating overview of the sort of variants of concern and how they're geographically located in different parts of India, and as well as strategies to overcome those geographical differences. And Dr. Srivats and Devashish from Prescient provided us with some really key insights and really some more questions, I think, around where do we go from here? What are the lessons that we've learned, and in the aftermath of this, what will we do to remind ourselves of those lessons so that we don't make these same mistakes, and also learn from the successes of what we did do right? Dr. Vasudevan, was also equally presented an equally interesting talk on the nutraceutical candidates that are being used, and specifically delved into spirulina as a potential candidate as an antioxidant supplement with very promising results. We heard from Dr. Hodgson at Saskatchewan and how he and his team have built a very impressive containment level 3 facilities in Saskatchewan that literally look to be the future of vaccine production, and not just production, but testing, animal testing, manufacturing, analytics, all of that is really where the future lies, I think. And that exists in Canada already. So it was a very proud moment to see that. And then lastly, Dr. Nazari really tied it all together kind of with his presentation on the various Ayurvedic treatments, specifically Ayush 64, which is a combination product of various herbal remedies, but with very interesting, promising results coming out of that for the treatment of COVID-19. And I should say that I've made a very big omission. Dr. Venkat Venkataramanan was also a key part of this biotechnology committee. So I apologize for that, Dr. Venkat. And you presented on your area of expertise, which is the use of UVC as a disinfection method to improve, the pandemic response, as well as disinfection of key pieces of equipment and key surfaces that come into contact with people every day. So to summarize, I guess my thoughts here are that we really have a meeting of the minds here. We had people from India and Canada demonstrate that they could come together, pull together their expertise, and really present on the latest and greatest, the cutting edge of technology. And we hope that this has allowed them to form some synergies, and that we'll go away from this and try and break down those borders and try and work together collectively to solve this issue. So that's my piece. I apologize if I went long, but there was a lot to cover here, and we really really did do a lot as part of this biotechnology group. And I will look forward to wrapping this up with our white paper. Thank you all, and appreciate your time.
Thank you very much, Rohin. That's very comprehensive. I'm sorry I could not be in your session. I would have loved to listen to it, but you gave me a quick summary. And for many of those people who could not be there in all three sessions, but this is beautifully done. Thank you very much, Rohin and your team. And I'm also happy that Santosh Hariharan, who has been part and parcel of this team for technical reasons and for the reasons beyond his control, he was not able to be actually named in any of these places. And I want to thank Santosh as well for his enormous contribution and his sharing of knowledge. Thank you and your team, Rohin. Let me go on to the third presentation, which I chaired. I should say I managed, but this one has got two components in this one, because when you talk about pandemic response and initiative, it is not one area you can look at it. And as you heard all through the day, this pandemic is enormous in scope, and you need the whole world to come together. And that means whole different disciplines have got to come together. And we have two separate groups. I could have made us 3 or 4 separate groups, but for management purposes, we made us 2 separate groups. So we will have, say, 2 white papers coming out of it. One is on the effect of pandemic on the non-communicable disease, as well as the effect of non-communicable disease on COVID, how it accelerates. And secondly, the second group, which talked about modeling and the vaccine distribution system. So we heard quite a length throughout the day and throughout yesterday, and the committee has worked tirelessly, both from India and Canada, for the last 7 months. And based on today's summary, the pandemics connect the entire world. So the issue is global, so that means we should find the solution also should be global. Until we address, until we vaccinate, until we cure the very last patient, or at least we can create the herd immunity in every community, in every country, the problem will re-emerge. Complications of pandemic extended beyond infectious disease. So the artificial division of non-communicable diseases, infectious diseases, road accidents, it doesn't exist anymore. They're all coming into one. So people who have got COVID have also been suffering with chronic disease. And oftentimes we hear, oh, he was suffering from COVID, but all of a sudden he died due to heart failure or sudden heart attack. Well, that is how the organs end. And then the pandemic showed that academia, government, and industry were able to pivot and direct resources towards COVID-19 and to rapidly develop solutions. I think this summit is just the introduction, and to bring all these groups together to make collaborations, to make it possible is quite a step towards it. Persistent public health and proactive measures are important in anticipation of subsequent waves. Today morning, we heard Dr. Srinath Reddy mention that India will come out of COVID only if it strengthens its primary health care. And he was a champion to bring public health focus in India. And now he is pitching for the primary health care. Yes, we saw that mainly in the main cities. Now the pandemic is now moving on to villages, but there is not enough infrastructure. So it requires much more. And then the policymakers have got to be even more vigilant. And what does this mean for our future? And we must work to ensure that our health, economy, and manufacturing systems are functioning, in a steady state that are accessible and equitable. I just stress the point, it should be equitable. Everybody should access. This will allow us to rapidly scale up and respond to the crisis state. Yes, granted that we were not prepared for the first instance in 2020, but we cannot say that excuse anymore. And every country and the entire world should come together to be prepared for any such future pandemic. We need to take away the lesson learned from the pandemic that are and continue to apply them to improve research and development, process the artificial intelligence, biotech, and financial technology or fintech. And finally, collaboration and knowledge exchange between various industries and countries must continue to implement proactive global strategies. So that is a summary the from this subgroup. But all these things have happened because of countless people worked behind the scene, worked to produce, and I have a number of people I want to name, but for lack of time, I am holding it. But my gratitude to every one of them who volunteered, who contributed, goes without any hesitation. And I'm very grateful to you for your support. Thank you.